Wouldn't it be nice if there was something that could help make our lives easier to get up, get down, and get around? I'm proud to introduce you today to a new and exciting proven breakthrough in medical technology that's made in the USA and has been awarded both U.S. and Canadian patents. It's called Gimme a Lift. It's different from anything you've ever seen. Gimme a Lift doesn't need batteries, wires, or motors. It simply works with leverage. Gimme a Lift is designed to be easy to use and help people in all walks of life with their mobility, both indoors and outdoors. Nurses have used it in the hospital, and now you can have the same one for your personal use at home. Don, I'm excited about your new lift. What would you tell everyone about how Gimme a Lift can help them?
Ray, I'd be delighted. Gimme a Lift can be used two ways. Assisted with the help of a nurse, caregiver, or spouse. It may also be used unassisted, that is, by yourself, especially if you live alone. Gimme a Lift can be at your side to help you in and out of a chair, couch, or bed. Gimme a Lift can help you when getting in and out of the car. And Gimme a Lift can help you when you need even to be transferred to a walker. Just listen to what people are saying.
I'm so thankful I've got the lift because I had shoulder surgery, both of them, and my both knees and my ankles. I have what they call bad bones. I don't know what I would do without it because I couldn't get out of bed without help. And with this lift, I can get out of bed. Before, I would roll over on my side and put this leg down first, and I'd have to bring this leg over, and then I had to put both hands on the bed to lift myself up. And I don't have to do that anymore. I just get this and I get up. I can do ever so many things that I couldn't do before. It's just, it's a miracle that I can have it, you know?
I first used the Gimme a Lift when I had surgery at Akron City Hospital, and that was the first time I'd ever been in the hospital other than having children, so I didn't realize how weak you were after surgery. And it was very useful. I had one in the hospital, and it helped me get around. But then when I went home, it was very interesting to me to find out how much I used it. And I would take the Gimme a Lift and just kind of use it as a stabilizer to help me so I didn't feel dizzy or didn't lose my balance. And it really helped me walking around when I was home alone, that I felt like I had a helper with me. It was a lot easier to get up than it would have been trying to use your own muscle strength because your muscles aren't as strong as they were before the surgery. I really felt like it helped me recover quicker.
As a former RN and someone who had to get people up in the hospital setting that needed help, this would have been something we could have used because we had to use brute strength and about 2 or 3 people.
Well, I have trouble getting up sometimes, so I can use the lift also. Just in front of me, helps me get myself up, balance myself, and away we go.
I'm big, and I'm tall too. And the bigger and the taller you are, the harder it is to get off the couch with your legs, especially if you have some pain or you have an operation or that kind of thing. It doesn't slide away from you, and it'll allow you, to push and pull and get up and down with a lot more ease than you would otherwise.
When I was first shown the lift and how easy it was to use, I knew right away that it was going to be very useful for both individuals at home and also for nurses in a hospital or office setting. I have the Gimme a Lift in each of my exam rooms to help my patients who need help in getting up from the chair to the exam table. I believe that Gimme a Lift will make life easier both for individuals at home as well as for nurses in an office or hospital setting. I highly recommend the Gimme a Lift as an aid for the 21st century.
The Gimme a Lift really made a difference in my recovery. I think it speeded it up. I think that I felt better and my body could heal faster because I was using the Gimme a Lift.
I've had it for about 6 months and I couldn't do without it, and I've recommended it to a lot of my friends. I'll just keep it until I die because I couldn't do without it.
I'd like to tell you a little bit about the special features of the Gimme a Lift. The backbone of the lift is the long shaft, which is reinforced on the inside. We do have the palm grip, which is at the top of the Gimme a Lift. It is extra wide that your fingers can fit around, and also your thumb for extra support. We have the circle on the inside here, which is used for a strap. And this strap is to help pull patients up that are unable to use their arms. We also have grips A, B, and C. These grips are soft for the patients that their hands can fit right around, nice and snug and tight. We also have the anchor pad. The anchor pad has 5 circles on the bottom of it for maximum grip.